Okay, guys, before I go ahead and film that sit down content, I just want to go ahead and send kudos and love and a huge shout out to those 7,000 nurses who are currently striking in New York City. I'm pretty sure you all are familiar. Over the past few days, 2 hospitals within the New York City region were unable to reach an agreement in their contract. So the nurses said, you won't give us safe staffing? You won't address our concerns? That's it. We're done. The nurses are striking. And I believe today is day 3. They're out in the streets, they're protesting, and they're advocating. Now, I just want to mind you all to be very careful with what the news is putting out there, because I've heard some commentators make statements that the nurses are selfish because they've abandoned their patient for the sake of money. Money? Let me tell you this. As a nurse caring for patients who are vulnerable, who cannot tell me when they're in pain, when they need to use the bathroom, and I have to be their ears, eyes, nose, skin, brain, I have to be everything for this patient, there is not a price tag you can put on the care that I give to someone who's not able to care for themselves. There is no amount of money that you can pay a nurse for all that we do for the patients. Okay, so that's just something I want to make very clear. This also takes me back to a few weeks ago when those nurses from Emory for making that ick video was terminated. And there were a lot of people online on social media saying things like, oh, I'm glad that they got rid of them. I'm glad the hospital fired them because they don't care about patients. Wrong. The hospitals did not fire those nurses because of patients. The hospital fired those nurses simply because of policy and hospital reputation. The hospitals do not care. They do not care about nurses, and they do not care about patients. If they did, we wouldn't have nurses, 7,000 of them, out in the streets of New York City protesting. And I hope that this strike sends waves throughout the nations. And I hope it also puts a battery in the backs of many of the nurses who are bending over, doing without to take care of their patients. I hope that nurses can see that there is solidarity when we come together. There is power in numbers. Nurses are the largest workforce within the healthcare system. We control healthcare. Not directly, because we're not the ones making the decisions. We don't have enough lobbyists. But ultimately, if all the nurses banded together and said, you know what, we're not going in today. We're not coming. What's going to happen? They will be forced to listen, okay? And I believe the hospital execs at Mount Sinai, as well as Montefiore in the Bronx, they called bluff on the nurses. They didn't think that they would strike. And as we can see, they are striking. So now those hospitals now have to divert patients to other areas. They have to cancel a lot of the medical procedures that would have been done. And we know medical procedures is what brings money to the hospital. But something has to be done, because as a nurse, I have worked in situations where we are stretched so thin that not only is the patient affected, the family members are involved, and the nurse themselves leave in extreme moral distress. That's the best way for me to put it. Extreme moral distress. I have seen nurses with my own eyes suffer panic attacks because we're so short. There's so many things that needs to get done, and everything that needs to be done is equally important. Like, it's not like shuffling paperwork or products around where it's like, I didn't get to dust this off today, I'll do it tomorrow. That's not the case. Things have to be done when they need to be done. And sometimes we can't get to it, or sometimes we get to it, but we sacrifice the hands-on care that the patients deserve, like giving a bath, being repositioned. Why? Because we have so many tasks and we just don't have the help. Hospitals aren't also taking into consideration the fact that patients are sicker today than they were 20, 30 years ago. Like, a patient comes in with not just one thing wrong. Usually we're handling and treating multiple systems. Like, they can come in with a stroke, but then you find out that they're a new onset of diabetes, or that they're retaining urine, or like the kidneys have become injured during the whole process of the admission. So much is going on, and there's so much for nurses to handle. So I just really stand in solidarity with the nurses in New York, and I hope that they can come to some kind of safe staffing agreement to where the nurses are not one nurse in the emergency room taking care of 23 patients, or a nurse on med-surg just having up to 8 patients. What? Let me tell you this. If I have to work in such situation, like let's just say med-surg, where, or even ICU, on the ICUs right now, where the strike is happening. Of course, they brought in nurses to replace the staff nurses who walked off the job. But those nurses are also being stretched thin that they're also quitting. Like the money is not even worth it, right? And the one thing that I like for people to know is that money is just a very temporary satisfying factor. It only satisfies you for so long before you realize, like, damn, we still up here taking care of having an 8-to-1 ratio. 8-to-1. If I had to take care of 8 patients on a med-surg unit, there will be no documentation. The patients will get meds, they will get hands-on care, and all that would happen is a narrative note. All that clicking in the computer is not happening. And what's so funny about nursing that I guess the general public do not understand is that we get bombarded with more and more responsibilities each year. And rather than push back, nurses just bend and bend and bend and flex and absorb all that is put on them. Very rarely do nurses fight back. We do not fight back. We absorb all that's given to us and we make it work. And guess what? A lot of the times we're achieving the positive outcomes because something is being sacrificed. You have nurses who are sacrificing their lunches, sacrificing their breaks, sacrificing their mental health, coming in a little bit early to review charts, leaving later than they should, punching out and then coming back to finish documentation. Nurses make it happen. And the last thing I'm going to say is that I hope this strike sends a message to hospital executives and hospital administrators and even the general public that healthcare would collapse if all nurses within the United States decided one day that, you know what, we're not going in. We're not going in. We're tired. We're tired. And we stayed home, healthcare would crash. Healthcare, hospitals, ambulatory centers, clinics, doctors' offices cannot run without nurses. So the demands for safe staffing, and even if they're asking for more money, is well due and very much so deserved.